Welcome to Apothecary Talks. I'm Dr. Jillian Stansbury. These are many short segments that are aimed at teaching beginner herbalists the art of putting together an effective herbal formula. This segment will focus on antimicrobial herbs and is part of a series that is aimed at creating custom formulas looking at individual actions of herbs. We have different recordings on antispasmodics and carminatives and adaptogens and alteratives and stimulants, and this segment will focus on antimicrobials. Antimicrobials could be classified and thought of in terms of different herbs that have an affinity for different tissues. Things we would use topically like tea tree oil, calendula, golden seal, that's hydrastis. Things that have a real affinity for GI infections, garlic, mahonia, that's the source of berberine, Oregon grape, chamomile, licorice are on the list, that's glycyrrhiza, urinary antimicrobials, most of you probably know of cranberry, that's in the Vaccinium genus, Arctostaphylos, that's Uva ursi. That is the list of some of our best urinary affinity antimicrobials. We also have respiratory antimicrobials, garlic, lomatium, thyme, eucalyptus, and most people are aware of sambucus, which is the Latin name for elder, which has an antiviral effect. So in addition to tissue affinity, we could take a look at antimicrobials, which have a different antibiotic effect on different types of microbes. Antibacterials would include many different essential oils. Antivirals would include that elderberry that I just mentioned, as well as lomatium, hypericum, that's St. John's wort, melissa. Antifungals include allium, that's garlic and onions, berberine that I just mentioned from Oregon grape and a few other plants, juglans, that's black walnut, sulfur, tannins are all antifungal for GI fungus or topical application, or things that improve cell barrier integrity, meaning how tight our cell-to-cell connections are that prevent different bacteria or viruses from kind of holding on and breaking apart cell barriers that allow infections to spread. In truth, many different plants are both antiviral and antibacterial, antifungal, and there is not a sharp delineation of things for viruses versus things for bacterial or fungal infections. However, this list are just some of those classic herbs that can be used as douches for vaginal infections and to treat lungs when epidemic viruses are going on. And I just have thrown in a few images of these beautiful plants. Calendula, hydrastis, that's golden seal. The golden name comes from the color of the roots. Mahonia, that's Oregon grape, the source of berberine. Vaccinium, that's cranberries, that contains mannose that prevents different bacteria from adhering to tissues. Uva ursi, full name Arctostaphylos. Uva ursi is one of the classic herbs for bladder infections, and it's in the same family as cranberries, the Ericaceae family. We have garlic, which is a great lung infection herb, GI infection herb, even topically, though it's a bit of a struggle to use garlic oil on athlete's foot and things. Thyme is antispasmodic to the lungs and very drying, so it makes an excellent respiratory infection herb, being both antimicrobial plus helps dry up the mucus and calm down the cough reflex. So learning these antimicrobials is a first step of putting together a good herbal formula. You can pick and choose amongst those antibacterials, antivirals, antifungals to give your formulas a greater tissue specificity. And then a step beyond that is to look at specific indications of herbs. We have covered in other of these recordings and segments that learning materia medica, that means our list of herbs to use as medicines, A through Z, can include learning what actions those herbs can provide. For example, we just talked about thyme. Thyme is both an antibacterial and antimicrobial agent, plus thyme will dry up mucus. An old word there is anticatarrhal. Catarrh means a lot of mucus accumulation in mucous membranes. Thyme is an antispasmodic. Thyme will relax the bronchial smooth muscles, so it's bronchodilating. So lining up all those indications or all those actions gives time a real specific indication for lung infections because of all those actions put together. And so when we're trying to treat a lung infection or a bladder infection, we don't want to just put into our bottle every antimicrobial that we've ever read about or heard about for the bladder or for the urinary mucosa or for the lungs. We want to pick and choose what is most specifically indicated for that person. For example, when we have abundant free-flowing mucus, we might want an anticatarrhal to help dry it up. On the other hand, when smokers develop chronic bronchitis and are susceptible to lung infections, because of the damage to the mucous membranes, they often will have a very scant and unproductive cough, and we might want more soothing herbs from slippery elm to licorice or kinds of moistening things that help them expel mucus by providing a little moisture to help those dry, irritated, or even deficient cilia, the little fibers on the ends of the mucous membrane, epithelial borders, help move mucus out. So when we learn the different materia medica, we learn actions and we learn their specific indications, and we could put together very different cough formulas, for example, for a smoker with a new onset cold or bronchitis or respiratory infection versus a toddler, where taste is going to be very important, versus a person that just gets a once a year or once every few years bad flu with sore lymph nodes and a sore throat and aching muscles and cough and lung congestion. We probably want more antivirals in that particular formula, or lymphatic and immune modulating herbs. And so through listening to these series, you will learn snippets of all of these different kinds of actions and indications. And to learn much more and take a deep dive, I've also written a 5-volume textbook series, Herbal Formularies for Healthcare Professionals. This goes chapter by chapter at GI conditions and pulmonary conditions and cardiovascular and musculoskeletal and reproductive and endocrine, autoimmune, and so on. And each chapter ends with an extensive list of materia medica of all of the herbs discussed throughout that chapter, and gives you more specific indications and action lists and niche reasons and tutelage on how to employ them as herbal medicines. So if you'd like to take a deeper dive, please refer to my textbooks. Thank you so much for listening. You can also obtain free content at my website, healingartsapothecary.org, where I have links to many other podcasts I've done and radio programs that I've done for other entities and individuals, as well as there's links to my own blog and papers written, as well as a new project we're working on, a recipe file to make your own fire ciders and cough syrups and medicinal foods at home. Thanks so much for watching Apothecary Talks.